Hi, I'm Massry, and I'm an oculoplastic or ophthalmic plastic surgeon in Beverly Hills, California. And today I'm going to talk about lower eyelid bag surgery. The reason I like talking about this subject is because operating on the lower lids can lead to complications such as change in the shape of the eye, discomfort in the eye, and irregularities. And I think it's important when this surgery is done, it's done by an eyelid expert. So I wanted to give you a pretty typical example of a patient who had the surgery. She's been kind enough to allow us to use her photographs, and I can use it as a representation of a typical type of patient that has the surgery and what we can do for her. So this young woman had eye bags. You can see them, the pen pointing to them under the eyes, with associated depressions or dark circles under the eye. Her goal was to smooth that out. You can see it on side view also, the elevation from the eye bag and the depression underneath. So how can you address this? Well, there's a variety of ways. You can make incisions through the skin to access the eye bag, or you can do it from the inside of the lid. In someone like her who's young with good skin tone, you certainly don't want to make cuts and scars in the eyelid. Also, when you do it that way, there's a much higher incidence of getting an eyelid shape that changes or a lower eyelid that pulls down. In fact, if you do it from inside the lid, the risk of this is negligible. And you can see on her post-operative photo, and this was only about 6 weeks after surgery, so she's still early on. There's a little darkening from bruising, which will go away, but look at the transition of the lower lid, the bag and the hollow, and afterwards it's gone. And on side view, the bag on the hollow, and afterwards it's gone. There's a smooth transition. This is the appearance of youth, and this is the appearance of eye bags developing as we mature. Now, how do you do this and do this in the best of way? Well, surgery must be done from the inside of the lid, and then rather than taking this precious eyelid fat that's herniated forward here and discarding it, you can use it as a filler to the hollow underneath, and you can see that by taking that fat and transferring it down here to the hollow, you can get a really nice contour and a much better result. It's a little more advanced and sophisticated surgery. It's called fat repositioning or fat transposition. It's an area of tremendous interest of mine. In fact, this whole field of surgery is, and I've published extensively on where to make incisions, how much fat to transfer, which plane to transfer the fat, and also long-term results of this surgery. Why is it important that I bring this up? Because this is elective surgery and has to be done right. We want to avoid complications. You want it to be in the hands of an expert. So someone like myself in my field, that's the kind of person you want to see. Because I've devoted so much time and energy to the research behind this, I think that I've learned some things along the way that help me really attain the outcome that we want to. And every patient, no matter how complicated or how many variables need to be identified and dealt with, should have this kind of transition where you have puffiness and hollows, and afterwards the puffiness and hollows are gone. I'm certainly happy to see anyone interested in this kind of procedure, and it was an honor to speak to you today. Thank you.